Hematology and oncology certainly sound like two different specialties. And as the Latin words assume, the heme part of it refers to the fluid. And so as mentioned, we're dealing with diseases of blood proteins, clotting, and that certainly sounds like something far from cancer. But as mentioned, there are a lot of cancer diseases that have to do with oncology. Leukemia is obviously a cancer of the white blood cells, and there's lymphoma, which is another subset, and so on. So it falls together. Oncology, of course, it's really more of a specialty looking at the solid tumors. So when you're talking about lung cancer, breast cancer, colon cancer, and so on, it's more of a discipline looking at the solid tumors. But yes, the two disciplines actually go together. In this practice that we're doing in adult oncology, it's really 18 and on. They do separate oncology in terms of pediatrics, looking at anyone up from infancy up to 18, and then those that are in adulthood. For the majority of oncology patients, you're really talking about from middle age to elderly. Cancer is one of those things that seems to take its toll on people really in the middle age to as we get older, because our bodies are changing, and as cells mutate, cells get damaged, that's when cancers form. But at the same time, no one's immune to it. I've seen my fair share of patients who have cancers in their 20s when they really shouldn't be at that age group. The vast majority of patients that we see are certainly middle to older age, but yes, it's not uncommon that we do see patients younger and younger. It's a question of what's happening. Is it mutational? Is it genetics? Is it due to our environment? Are we having more exposure to chemicals? I'm sure the media is filled with stories about more processed foods and processed meats, artificial preservatives, and everything else that we're exposed to. It's a good question as far as why is there an epidemic of cancer. Certainly with the baby boom generation now, getting to that age, I'm certain that myself and other colleagues that are involved in hematology oncology are going to be seeing more and more cases, but it doesn't exclude our younger generation as well. I think the most common misconception is the length of time you have left. That's by and far the largest one. I think that people also think that cancer is contagious. It's not contagious. You're not going to pass your cancer on to someone else. I think that when you talk about the cause of cancer, certainly there are things that in nature, like viral illnesses, there's lots of examples that I can give where viral illnesses are associated with certain cancers. There are different things that we're probably exposed to, from primary to secondhand smoke, that we worry about. But in terms of the general misconception is that most, I think, novices who are thinking about oncology say, oh, why would I want to go into cancer? Everyone dies. I think that would be, I would put as our number one misconception, that no, not everyone that steps into an oncologist's office, has a one-way ticket, to the mortuary. Oncology, because of its very nature, you have to be compassionate. That's probably by and far the biggest one. I think that you have to be, more or less empathetic as much as you can. I certainly know colleagues that, as they say, are very cold and not caring, and they basically treat everything very robotically. No, but that's not me, and I don't think that those types of personalities make the best oncologists. I think that because of the subject matter you're dealing with, you have to put your own feelings on the line. You have to make sure that you are feeling what they're feeling. And over time, as I mentioned, I began to realize that I glean a little bit of pride from the success stories. I also, I think, lose a little for those that I can't. But at the same time, I began to realize that no, I'm not here to be God. I'm not here to actually dictate what's going to happen, but rather provide the options and the choices and education, to everybody available. And from there, as mentioned, try our best to change the natural course of this disease. And I think that's maybe, the other thing that highlights, characteristics such as being very, very patient, certainly playing a role in different things. And you have to recognize that in some ways that there's a little bit of courage involved as well. Patients will feed off of your fears. And so if you give a sensation that you have no confidence of what you're doing, how in the world is the patient going to feel any confidence of what they're going through? So really, I think empathy, being patient, and as we said before, demonstrating a little bit of courage are some of the things that would come to my mind.